Boris Johnson has broken 2 election promises this afternoon, due, he says, to the costs of the pandemic. First, upping national insurance to pay for health and social care, and then temporarily getting rid of the protection to state pensions, the so-called triple lock. More on that in just a moment. First, though, those plans to stop families being burdened with what the PM calls the unpredictable and catastrophic costs of social care. Now, here's how it's going to work. From October 2023, anyone with assets below £20,000 will have the cost of their care fully funded by the state. Those with assets between £20,000 and £100,000 will get some state support and pay for the rest themselves. But there will be a cap, which means no one will pay more than £86,000 for care over their lifetime. To help fund this, the national insurance payments will rise by 1.25 percentage points from April next year. From 2023, it will officially appear on your payslip as the Health and Social Care Levy and will be paid by all working adults, even those over the state pension age. More now from our political editor, Andy Bell.
That's very complicated.
It has been complicated, but the Prime Minister now believes he has slotted all the pieces into place for a plan to bring more money to the NHS and fund social care in England. He told a packed Commons it could only happen with a tax rise.
As a permanent additional investment in health and social care, it would be irresponsible to meet the costs from higher borrowing and higher debt. From next April, we will create a new UK-wide 1.25% health and social care levy on earned income hypothecated in law to health and social care.
The government says a basic rate taxpayer earning £24,000 a year will pay an extra £180 a year. A higher rate taxpayer earning £50,000 will pay an extra £505. But 6.2 million low earners below the national insurance threshold will continue to pay nothing. He also said the governments in Scotland, Wales and Northern Ireland will receive more money than taxpayers in those countries will pay out. And he said the tax on shared dividends would rise to help pay for the plan. But he had to admit he'd broken a promise.
And of course, no Conservative government, Mr. Speaker, ever wants to raise taxes. And I will be honest with the House, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker.
For opposition parties, this is still an unfair tax for which the pandemic provides no excuse.
The pretence that the Prime Minister is only here because of the pandemic is not going to wash. He's putting a sticking plaster over gaping wounds which his party inflicted. He made that commitment on social care before the pandemic, and he said he would pay for it without raising taxes before the pandemic.
The scandal of the tax hike is it will fall hardest on the young and the lowest paid, the two groups who have suffered the worst economic consequences of the pandemic.
And for some, today's announcement is much more about raising more money for the health service than fixing the care system.
Well, the numbers show very clearly that the NHS is the priority. We're increasing spending by around £36 billion. In total, only £5.4 billion of that is going on social care and around £25 billion is going to the NHS.
It's a beautiful day, isn't it?
He hopes it is, but will the big claim of fixing the NHS and social care hold up? Andy Bell, 5 News.